Hello, this is Dr. Malesko again, and now we're going to finish out this week 3. So we're going to go over chapter 6, microbiology related procedures. So let's get started right away, not waste any more time. Let's discuss the medical waste and what that entails. Basically, you can have infectious and non-infectious medical waste, and we have to have a procedure on special handling. So I would probably advise you that you read the chapter in much detail so that you understand in detail what needs to be done when it comes to special handling of medical waste. Proper procedures are necessary for obtaining culture from like body sites without contaminating the area. So for example, if you're getting a wound culture, you want to go directly into the wound and not around it or touch anything outside of that wound so you don't contaminate it. You want to get the exact source of the infection and not particularly the skin flora around it. So infectious waste disposal is super important. You want to be able to get rid of solids and liquid wastes, which may cause disease. So if it's inappropriately handled, that is an issue. So everyone needs to be aware of how to transport it, making sure that it stays sterile in a packet, and how you dispose of, for example, blood products and for example, the particular soiled products and how they go in a red bag, right? So super important not to contaminate anything else. Examples of waste, for example, body fluids and items coming into contact with body fluids, super important. Handling everything with gloves, making sure that everything is in a biohazard container for disposal. Making sure that non-sharp objects are appropriately taken care of. For example, liquid wastes, pathological waste product, patient care items, all of those that are non-sharp versus sharp. Sharps needs to go in the sharp box, needles, IV tubing, etc., scalpel blades. Of course, remember how to remove them appropriately without getting hurt. Glassware, all of these things super important on maintenance and not contamination. So maintaining that cleanliness and being able to discard everything in a clean way without contaminating other things around. So disposal of non-sharp items, wearing gloves, for example, soiled products, everything goes in a biohazard bag, a red bag, 3/4 full, never want to do too full because it can burst, right? You want to seal it, making sure it's completely sealed. Any liquids, as per Department of Health regulations, wherever you need to discard those liquids, you need to be aware and be told exactly where you're going to discard those safely. Place the liquids in a leak-proof container in red infectious biohazard bags, and of course, removing the gloves and washing the hands appropriately after utilizing the leak-proof red bag containers, right? Putting everything in there. Then you have to remove those gloves and wash your hands. All right, so sharp items. Well, when you're wearing gloves, place the sharps in a disposable sharps container. Never recap needles. As I said in the previous lesson, always seal the container 3/4 full. Never force instruments into a sharps container if it's more than 3/4 full. So get another sharps container. Never place sharps containers in normal waste disposal. Sharps and sharps box, always. Wash the hands after completing the task, always. Gloves are not always needed, but do not, waste or misuse the PPE, right? So when you don non-sterile gloves, that's a whole different story than when you're going into a sterile area like the operating room, right? So non-sterile gloves, after you finished, wash your hands and then dry your hands. Remove one glove from the box, side glove, and then the other hand with the gloved hand. All right, remove another glove by side to slide on the bare hand. So you're going to slide it in, and then to remove it, you're going to flip it. Okay, interlace fingers, push down between, and you can make sure that you have a proper fit when you put them on. Remove immediately after you finish using the gloves. All right, grip one glove at the base of the palm and pull it off. Okay, pull it inside out, all right? Place it in palm of the other glove, slip bare fingers under the glove at the wrist, push the glove down, and basically that's how you remove it, all right? If you have any confusion on this, there's so many YouTube videos on how to glove, okay? All right, so you could do the open and close method. The open is you open up the sterile gloves, wash and dry the hands before and after gloving, dispose the gloves in appropriate container. Closed is you don the gloves without the possibility of sterile outside of glove touching skin of the healthcare worker. This is used by personnel who are scrubbed in the operating room, okay? So you're wearing a sterile gown and you're gloving yourself or somebody else is gloving you. All right, again, I'm not going to review that here. Watch the YouTube. There's so many, okay? And of course, read the book. There's so many good pictures that'll tell you exactly how to do it. All right, so two types. You got the medical and the surgical in terms of asepsis. So you got medical means you're just reducing the number, growth, and spread of the microbes. Surgical, you're actually eliminating all microbes. You don't want to have any. No spores, no microbes. All right, so that's sterile versus, surgical versus medical. Huge difference. All right, with surgical, you're scrubbing and you're creating a sterile environment. With medical, you're just reducing the growth. It's a whole different ball game. Hand washing, gloving, changing the beds, linen every single day, cleaning the furniture every single day, cleaning the floors every single day. That's medical asepsis. All right. Surgical asepsis is in the operating room, surgical hand scrub, all the sides, 15 minutes, yada, yada, sterilization of the instruments, surgical attire, proper donning of gloves, making sure you have eye goggles, mask with shield, and you have an established sterile field, and it's used for operating room or delivery of a baby, diagnostic and therapeutic interventions that need a sterile field. All right, so hand hygiene for surgical requires careful scrubbing of hands and the nails and the wrists all the way up to the forearms. 3 to 6 minute scrub, up to 15 minutes if you have time. Since skin is not sterile, donning of sterile gloves is required, and to maintain the sterile field, you need to go in and with your sterile side, touch only the sterile side, not the unsterile side, the under the glove, okay? That's how it goes. That's how you do it. All right, so guidelines for determining the areas of sterility, making sure that everything from the elbow down distal is sterile, okay? Everything below the chest is not sterile. Below the navel is not sterile. So if you're standing, everything above the table is the sterile field, okay? Making sure that you have insertion of IVs in the right location. Having a sterile field is in fact the site where you're performing the procedure. Everything below that, like where you got the tubing and everything that is below, that is not sterile. That's not considered sterile. Now, sterile objects must be dry and should not touch non-sterile objects. Maintain visual contact of the sterile field at all times. Anything below the waist, remember, anything from the navel down is considered contaminated. Watch, there's so many videos on operating room protocol. And not to mention, when you read the book, you'll see all the tables. Using aseptic technique, make sure you note the date, the time, the site, when you're collecting, whatever you're collecting, if it's a wound culture, all right? Transport immediately or refrigerate, whether it's blood, CSF, etc. Always make sure that after you finished this presentation that you read the entire chapter and refer to all the tables and texts in the book. Blood cultures. Blood cultures, you got to go in at a specific angle, and it's a very aseptic phlebotomy procedure. You need to prep the area clean and transport the blood immediately and store at a particular temperature in an incubator at 35 degrees Celsius. Don't refrigerate. CSF, for example, very, very strict protocol. It can only be obtained by a physician or especially trained personnel. You take about 8 to 15 milliliters of fluid withdrawn and from a lumbar puncture. You could also do a sputum culture. This is a different type of specimen collection in which the patient is going to expel phlegm after a deep cough. It needs to be immediately transported. If not, it must be refrigerated. Wound culture, again, needs to go right directly into the wound, not anything around. And make sure you do a deep swab and again, transport it immediately or refrigerate. With respect to urine specimen, avoid bacterial contamination to the distal urethra. You need a clean catch specimen, catheterization or suprapubic aspiration, transport immediately or refrigerate. Stool specimen, again, you need to have the transport medium and immediately transport it, or again, you have to refrigerate it. Throat culture, sterile throat culture means you take the sterile swab deep into the throat. Do not touch the tongue. Do not touch the sides of the mouth or the uvula, which is the U-shaped little thing that hangs down back posteriorly in the back of your throat. None of those things must be touched. At all times, you do not touch any of that. Go directly down the throat, transport immediately, and get the culture result. With nasal swab, which is done for the COVID test, right? You got to insert at least 2 to 3 centimeters deep, transport immediately. Reminder, always refer to the text for specific instructions for each of these specimen collections, all right? And if you want, again, there's so many YouTubes on specimen collection of all the different types that we just discussed. So to summarize, you need to dispose of medical equipment, medical waste, and sharps appropriately. Donning and removal of non-sterile gloves, read the book on it and watch videos. Donning and removal of sterile gloves versus non-sterile gloves, 2 different stories. Gloving does not replace hand washing. Always wash your hands before and after. Obtaining culture specimens, aseptic technique, super important so there's no contamination of blood, CSF, sputum, wound, urine, stool, throat, nasal, all of that. Proper transportation and storage. And if you can't use it right away, you need to store it in the refrigerator. Asepsis, making sure that you know the difference between medical and surgical. Maintaining sterile field. Everything above the waist is sterile. Everything below is considered what? Contaminated. Okay? Never drop your hands below your chest. Okay? That's the way it works. Anyway, if you want further details, please read the book Specimen Collection, referring to the textbook for specific instructions on each and every single specimen and how to appropriately obtain the culture so that you can get an appropriate result that will really indicate what is going on and not contaminated species. All right, that was it. I hope you enjoyed this lesson, super quick, and I will see you next time for week 4, 2 more to go. Bye. Let me end this now.